me and she said that, you know what, let's not keep going backwards. Let's not keep saying that I told you so. So I already said I told you so, several weeks ago. So I put that in the past. But what we want to do is moving forward. But to move forward, I think we need to continue to ask for transparency. I think the government, if they want everybody's help, the people of Guam's help, they have to be transparent with the entire population of Guam. So in order to do that, reporting has to be good. Data has to be good. Don't just tell us this and then you're not telling us all of it. Tell us everything you know, okay? It's not the media that's causing the panic. I think we know that this death is occurring. We know that the very first case is a community acquired. It's evidence of community acquired right there and then. We should be locking down, and I think I'm glad that the government extended the lockdown. I don't know if 14 days extension is good enough, but we'll work with it. But, I think the people of Guam know that the virus is here, so I think they know what to do. But we need to keep the message going, and I think KUM is partnered up with the Medical Association to do some public messages. All the media has, so we'll work with you along with other people. I know Dr. Peter Lombard has been excellent in trying to request for more information.
Right.
Data reporting, because without the accurate data reporting, if they're not sharing it with us doctors, we're not going to know exactly what's going on. So we ask for transparency, not just for the doctors, but for the entire island.
The governor, she does have her physicians advisory group. Are you part of that, or are you guys?
Oh, no. I think I don't think I'll ever get invited back to any kind of advisory group or anything.
Sorry, Doc.
Chris, well, part of it is that I cannot be controlled, and I think that's good and bad. If a government can't control you to go by what they say, of course they're not going to invite you back. It's okay. It's okay. It's okay not to invite me back. I'm perfectly fine with that. But those advisory group people, they still got to be transparent. They have to be transparent, because if they're not, they're going to lose their credibility. And the people of Guam knows. Even the doctors who's on the advisory board, they need to look at themselves in the mirror and be transparent. Ask themselves one question: am I being honest? Are there anything hidden? If they can answer that question and look in the mirror and say yes, then God be with them. But, they got to be transparent, okay?
Doc, what do you make of this way that they've changed their approach to COVID-19 testing? We got the release that now testing is limited to priority groups, which include hospitalized and ER patients with COVID-19 symptoms, people with chronic disease and COVID-19 symptoms, healthcare workers and first responders with COVID-19 symptoms, and older people with COVID-19 symptoms.
Well, I think that's good. I think that's good that they're doing that. I'm not against that, certainly. But I think we still need to conduct more tests. And that's why I'm going to tell you we're going to try to bring some international kits in. The FDA, the CDC is way behind. Only now they're starting to look at serological tests. If you look at my Facebook post back in January, when they said we don't have testing kits, we don't have testing. Well, I already posted on there, you can test it from blood. And I was right, because international countries are already doing it. It's a rapid test where you can get a result within 30 minutes, and now it's down to 18 minutes. So that's what they're doing in Japan, Korea, Taiwan, China. So we are procuring those kits in. And, we want to work with the government on this. We if we can test 5,000 people, we're going to test 5,000 people. And we'll make sure that those kits are calibrated to make sure they're accurate.
Okay, Doc.
Doc, how much do you think that, and I brought this up with Dr. Cabrera, while we're testing these priority groups, in the meantime, is the disease, is COVID-19 being spread at an alarming rate?
Yes. Yes, and yes, and yes. Because we have evidence of community spread. It's out there. Chris, you're going to assume everybody is positive, everybody's a carrier, okay? When you go outside, distance yourself. This is why we say social distance is very important. And we brought up the fact about Italy, for example. Italy, the Red Cross, the vice president of Red Cross went to Italy yesterday or the other day, and they went there and is evaluating, helping them, saying, hey, why is your death so much higher than China? So they say, you're not properly monitoring your social distance. You're not properly locked down. You don't have a lock. You say lockdown, but it's not a lockdown. Furthermore, at the very end, she almost scolded the Italians to say, you people are not wearing a mask. You people are not wearing a mask. So if you think about it, patients who come into our medical offices, okay, if they say, hey, you have a slight illness or you have cough or any kind of flu-like symptoms, go ahead and put on a mask. because we want you to protect us. We don't want you to spread it. So we put on masks on those people who think they can spread the disease. So if you think about it, if the community is already have evidence of community spread, if you assume that everybody is positive or they're carriers, then they should be donning on a mask when they go out. Now, those people who is locked down in their home, they don't need to wear a mask in their house. But if you're going to go outside, I think it's okay to wear a mask. Now, if you look at the video, the PSA video that came out of the government of Guam, where Dr. Robinson was involved, he was part of the advisory group. If you listen to his video carefully, he said, go to the supermarket, one person, and wear a mask. So right there and then, Dr. Robinson is already saying, wear a mask when you go out. So if the government of Guam or anybody, or CDC, say you don't need to wear a mask, I think we need to learn from these foreign countries that Japan, very mask-friendly. Taiwan, very mask-friendly. Korea, very mask-friendly. China, Hong Kong. These countries are very mask-friendly, and they're containing their spread. They're containing it. So I think we need to learn from them. I think no longer that we can say wearing a mask doesn't help. I don't think it harms. You just need to make sure that, if it's disposable mask, you got to throw it away. There's no way to really clean it. But the shortage of masks is going to be an issue. But if everybody's on lockdown, and only those people who's going outside maybe donning a mask, that might be a good idea. I'm not saying that I'm right, but I'm saying that this is what the other countries are doing.
Doc, what did you make of Dr. Cabrera's announcement that, given the current spread rate of COVID-19, that our healthcare system could reach a breaking point by the end of this week or next week?
We talked about that last night in our physicians chat. We had about 31 doctors that was logged on to our chat group on the Zoom video, and we were at 7 p.m. We're talking about an hour, and we kind of wish that he would kind of talk to us. And in fact, that we invited him into the video chat. We don't know what the data he is presenting, so we like to bring him in, and I like for him to talk to us about it. I know he's talking to the media and the public, but as a physician advisory group, I like them to be, talking to us doctors about it. He had an opportunity to talk to about 30 of us last night. So we invite him to the next chat and present us the data. Tell us about this curve, and tell us about this 33% spread versus 200% spread. Now, I can tell you this: with a population of 160,000, you don't have to be a rocket scientist. With nearly 30 positives compared to Hawaii yesterday was 48. Today, I think they went up to 50. So 56, I think, today. But Hawaii's population is 1 million people. 1 million with over 1 million plus tourists that's going there. So a population of 1 million people is already at 56, and a population of 160,000, with the density that we have in our villages, we are already at nearly 30. So that'll tell you we are very infectious right now. So we need to make sure that people listen to the governor, stay home, don't come out.
Doc,
come out only for essential items that you need to get, and that's it, and go back home.
I wanted to ask about the home isolation and the 20 that we just found out that there was 20 on home isolation. What are your thoughts on that?
Okay, I think the home isolation aspect of it is okay. Only for sure that home isolation is appropriate for that particular person. If they're sick, they got to be in a hospital. But if they are in home isolation, what I'm talking about is this: they're in a home by themselves, not with a family member. And if they are with a family member, that person who is home isolated, if he is, he needs to be in one room by himself. That's it. You cannot be in a room in a living room with your family members. That's not going to work. So if you turn positive, your other people in the room is going to be positive. And that's happened on Guam, because I got a text from somebody that actually happened. So you got to know that you can spread from person to person. So if you're going to home isolation, you got to do it appropriately and do it the right way.
But do you think people are going to do it the right way if, all they got to worry about is public health calling a couple times?
Well, I think if you love your family and I think if you care, they should. And if you can get the message across, this is what I do. Don't force the people. If you force the people, they're going to go against you, right? So what you need to do is collaborate with them and telling them that, hey, listen, think about your daughter, think about your son, think about your grandma, okay? If you don't want them to get sick, home isolate the proper way. Talk to them and be fully transparent with them. What would happen if we don't? Like, you tell them, you got to do this, you got to do this. They're going to revolt. They're not going to do that. This is just human nature.
Right.
Same with Gulf Guam. If Gulf Guam wants us to be a one-team player, you got to be transparent. Come on.
Yeah, I think it's just so confusing and hard for me to understand when, these patients were allowed home isolation on Friday night, and then Saturday night you get Saturday afternoon you get a press release that was only temporary at 9, and then they were going to move to the SNU, and then Monday you find out that there's 20 on home isolation.
It's rapidly evolving.
Yeah,
is what they're
and,
saying.
and then the mayors who were told, according to Robert Hoffman, what he's saying is accurate, that he was told in a group chat over WhatsApp that some of these home isolation patients that don't have, a bathroom in the room, they would be moved to the Pacific Star. So I'm just kind of wondering if you shouldn't have you checked that before letting them into home isolation, whether or not their homes were suitable. But
yeah, I think again, if the government couldn't get SNU ready, I think if that was the reason, just be transparent with us. I think
right.
The truth will always set you free. That's what I think. And, I didn't make that statement up. Somebody else did.
Yeah, and Dr. Shieh, I think at this point, within reason, no one is going to fault the governor. We all know the health, they've been ignoring the hospital, everything it's been decades. So I think you're right, if they come out and they just say, hey, skilled nursing unit, it's a 20-year-old facility. We're not able to get the wings ready to house everyone, so instead we're going to do this. I think that's a lot better than, in this time of crisis, public health emergency. You don't want your government to announce one thing and then do a 180 the next day and then do another 180 the day after that. And
Yes, I agree. And I think that most of our doctors feel that way, that, if they want us doctors together in one team, versus virus, then be transparent with us. Mm-hmm. Don't try to downplay things, or don't try to hide behind a certain curtain and say, okay, this stays in this room, it doesn't go out. Let's not, when we release room, let's just say this. Those kind of stuff got to be stopped, because when you do that, you split up the group. What you want to do is be honest. If you can be honest with yourself, be honest with the people, I think we will follow. I will follow. But what I can't take is inconsistencies and somebody that's not telling the truth. If we can ensure ourselves, hey, be totally transparent. For example, I was on the Facebook Live this morning, and I try to do that with my patients every day. And somebody messaged, hey, doc, what about the federal contract and what's going on? Be transparent. And somebody last night, Dr. Akimoto mentioned, there's contracts being sent out. Well, let's be transparent with those contracts. Mindy Abraligo is trying to get the truth, and they're saying they're not responding to her. KUM, I would encourage you to get transparency from the government. I think that's your job in the media, is to make sure that you seek the truth.
Right. And Doc, so what I'm assuming here is that, they're running everything through the spin cycle. Has that kind of been your experience, that you think that we get information and then they got to kind of write it a certain way so people don't freak out?
It's not. It's too late for that, about freaking out. Let's get over that bridge about freaking out. That's over, okay? What we need to do is try to recover, gain the confidence back of the people, get a confidence back of the doctors. And listen, doctors don't always agree. I can tell you that. There's probably some doctors out there that think Dr. Shieh is speaking for himself and not for other people. That's okay. It's okay. I don't mind being overreactive. I'd rather be overreactive than underreactive with situations like this. Even Dr. Cabrera is saying there's going to be death. Well, when you announce that, you don't think people are going to panic? Of course they're going to panic, right? Of course. And when you tell people that if we don't work by end of this week, we're going to shut down, well, people's going to panic with those kind of messages. But I think what we need to do, again, transparency is key. That's going to be the number one thing for this government of Guam. If they want people to follow, they want people to listen, they got to be transparent. And if there are federal contracts out there for federal funding, make it public. Who's getting what's going on, so that everybody can see, so that later on there's no question about improprieties, what's going on. But don't let those contracts, stop this island from moving forward and getting things done. Make it transparent and make it known that, hey, these are contracts going for this hospital. This is a contract going for this clinic, whatever you do. The hotels, what are the hotels getting? Those are federal funding that needs to be accountable. And now is the time for the government to step up and say, this is what we're doing, and this is the accountability we have, and this is what we're allocating to what. That's very important. If they can do that, I think the people of Guam will follow. They will follow because our government is being transparent.
Are you aware of who all is on the Physicians Advisory Group other than Dr. Cabrera, Dr. Cruz, and Dr. Jolene Uggen?
I think so. I think if you look at that PSA video,
Okay.
I think is on there, and Dr. Michael Robinson, Dr. Jeff Galgo, Dr. Romel Carlos,
Dr. Michael
Dr. Michael is on there. Yeah. So those are all hand-selected people by the governor, or Dr. Mike Cruz. So I think they're good people. I think they're our colleagues. So I will listen to them. But again, they got to be transparent, very transparent. That's going to be the key.
But for now, there's been no communication between the Physicians Advisory Group with the Guam Medical Association.
The only one that's communicated with us is Dr. Hoa, and he tuned in yesterday. So we gave him some criticism about being transparency too. So I think he'll take the message back. But then again, I encourage Dr. Nguyen to be transparent as well himself. So it's very important that, and you got to be very careful. Once the government brings you in, they will try to take control of things. So you got to make sure that you also be transparent. As physicians, we need to do that. We got to be honest with ourselves.
All right. Well, thanks for calling in. I know that we've been messaging each other about partnering with the Guam Medical Association, and so we look forward to hearing from you or someone from the organization on a daily basis to help spread awareness and provide.
Yeah, I'll try to. What I'll try to do is I'll try to get other people to come on the radio with you, and I'll share your number with people who can. All right.
All right. And I should be expecting more videos today for the PSA campaign.
Hopefully.
Okay.
We're so busy.
Yeah.
Patients in the meantime too.
Right.
Now
right.
I know it's so hard to do those things. God, it's so difficult.
Shoot it horizontally and forward it over.
We're ordinary doctors. We're not professional PSA people.
Right. Okay, Doc, you're pretty handy with social media.
I mean, a lot of the times that when we do the video, it's like one take. That's it. It's like, oh no, what did I say?
Right. Right. Okay,
we'll
Doc.
try to do as fast as we can for you. We'll work with you.
Thank you.
right.
Thank you very much.
You're welcome.
Dr. Tom Shieh, not changing his tune. A lot of people are changing their tune lately, but they've been saying the same thing from the beginning. We're not prepared. The health system is going to crash. We don't have enough tests. We need to be testing more people. And, that's what he's saying.
Right. And so, like you said, he also wanted to move forward and stop looking back. And he said, all right, I told you so. So
Right.
that's done. But yeah, like I was saying earlier that, we've been speaking with Dr. Shieh about a PSA campaign to help spread awareness and what